Unfortunately, the biggest single problem in Obamacare is now being carried over into the Republican Obamacare reform and repeal bill. And if it's there, it's going to have the same negative effect on the new system that it had on the old system. When the original Obamacare bill was going through the Congress, people said, oh, maternity benefits. They said, oh yeah, we got to cover that. Mental health benefits, oh yeah, sure, let's put that in. Substance abuse, oh yeah, let's do that. And they ended up coming up with 12 categories that had to be completely covered before the federal government would approve the plan and put it up for sale in the various insurance exchanges. And those loaded up the plan to such expense. Behind each special interest, behind each service, there was a special interest. Behind each special interest, a lobbyist pushing for that to be included. So it ended up being a crazy system. Men have to buy maternity benefits. 60-year-old women have to buy birth control services. People that have never been near drugs have to buy substance abuse stuff. People that are completely sane have to get mental health benefits. And the result is this huge escalation in cost. And that's why nobody wanted the policies, because they cost so much and the deductibles were so high because they had all this stuff in it. And when somebody came in and said, hey, I just need catastrophic coverage, I'll take care of the rest, they said you have to be under 30 to do that. 35-year-old couldn't do that. And as a result, most of the insurance needs were not met. Now, in the new bill that Ryan is putting forward, those same list of services are in there. There's no change in those at all. And the whole change in the bill is how we finance it. Do we use tax credits instead of subsidies? Do we have refundable tax credits? All kinds of different technical questions as to how you can change the program. But the fundamental thing is that the stuff that's driving the cost is not changed at all. And as I mentioned in a previous video, we also need to change what we cover in Medicaid. When you go up to lower middle income people, they can afford a deductible. They can afford a copay. You probably know stories of people that go into the emergency room and there are 90 people there kind of shooting the breeze. It's sort of the community center. Although you can eliminate that with deductibles, copayments, and some of that stuff. That's got to be put in that bill. But the main thing is to change that list of services so that you can write a policy for a 35-year-old married couple with no kids for catastrophic care, or with kids who are covered by a separate program, CHIP, to protect the adults for catastrophic care. That's what most young people need and want. But it's not in the bill now. It's not in Ryan's plan. So please write your senator and your congressman, particularly if he's a Republican, and make that clear. Thanks for watching.